Okay, Doctor, is it Uzel?
Uzel, yes.
Uzel, look at that.
Yes,
Anyway, thank you for coming on today, the Jersey
of course,
Buzz.
yes.
The
Thank you for
buzz is
inviting
back.
me.
Anyway, so the reason I'm bringing you on
Yes.
because you are a periodontist
Yes,
and you have a very interesting background.
Yes.
And I feel like it's important for people to understand that not only do you have the skill set, but supporting small businesses
thank you.
in retail and restaurant, but you can also support a small bit in a family-owned business such as yourself,
True.
right?
Yes.
Keep those teeth and gums.
Mhm.
So it was very interesting. You're a doctor of science in bone biology. What
Yes.
is that?
Well, it's like a PhD in Boston schools, Harvard and Boston University. They offer those degrees that are combined with specialty training.
Okay.
So what I did was a 5-year program at Boston University. Intense research program, actually. We published in molecular biology journals back then, 25 years ago. So what helps me with in day-to-day practice is to envision the biological aspect of what we do. Most of us, most dentists, most patients think that it is more a cosmetic thing or a filling to be done. It's more mechanical, but there's a lot more biology going into dentistry, especially to my specialty, periodontics. So we deal with bacteria. Most dentistry is based on addressing problems created by bacteria, whether it's cavities or gum disease. And bone obviously is affected by gum disease. And what I did was directly correlated with what I
Okay.
would practice.
I guess now that you say it, that's important
Yeah.
to know that with what you do.
Yes,
So
exactly.
tell everybody, what does a periodontist do? Like, go ahead.
A periodontist is a gum specialist in essence. Of course, gums mean soft tissue, yet we are specialized in treating gum disease. Periodontitis is the technical name of it. Half of US population has gum disease, and not everyone has access to a specialist, but common symptoms are bad breath, bleeding gums, loose teeth in more advanced cases. Therefore, a lot of patients directly see us for those problems, or we get referrals from local dentists as well. So it's the most common dental problem. The most number of teeth are extracted because of gum disease,
Really?
not because of cavities. And in many instances, I had to extract full mouth of teeth that had no cavities. Yet advanced gum disease with abscess, pus, and all that stuff. So it is a serious condition. More importantly, I don't want to scare you.
I know, I'm like,
But
oh my gosh, but it's like you said, like how many people, if we were to do a survey, how many people floss? So many people don't. They just brush their teeth.
yes,
Is flossing really?
it is important because
Okay.
about 40% of tooth surface is in between teeth. So we don't have a direct access with a brush in between the teeth. Floss takes care of it. What it does is it mechanically kills bacteria. Plaque is bacteria with food. Therefore, flossing is important as much as brushing. So daily flossing is recommended for everybody.
Okay, so here's another
Of
question.
course.
How many minutes are you supposed to brush your teeth?
Well, depends on how big your teeth are. Well, I would give like 10, 15 seconds a tooth, roll the brush from right to left, left to right, inside out. 5 to 10 minutes if you want to really thoroughly do it, basically.
5 to 10 minutes
Yeah.
brushing your teeth?
5 minutes would be reasonable.
Do you
Quick
brush
bru-
your teeth for 5 minutes?
I do, actually.
Wow.
I have beautiful teeth, as you can see.
I was gonna say, I bet you if we took a survey,
Yeah.
I'll have to get Steve on that.
I don't have, they're all reals. That's the good news. Except I have 2 crowns in the back.
Well, I was gonna say you have your original
Yeah.
teeth, which is always a good
Yeah.
thing. So, wow, I can tell you right now, most of the human race does not even A, know that, or B, do that.
Yeah.
Just take a survey.
Well, it's the mouth is the entry port of the
Yeah.
body. So we have millions of bacteria in our mouth. So we have to reduce the number of those bacteria, as we cannot make our body, our mouth, our skin, our intestines have millions of bacteria. Yet if you reduce the number of it, of those bacteria, then we would have less chance of having gum disease and cavities. So that's, certain things like orthodontics, braces, they're more genetically inherited, but the diseases of the mouth, essentially gum disease and cavities, other than pathologies, of course, are all related to bacteria
Yeah.
mostly. So
So, okay, now, not to put you on the spot,
Yeah.
but what's this fluoride? I keep hearing about fluoride that it's not great. Like, can you give, there's a lot of things out there.
fluoride reduces the chance of having cavities on teeth.
Right.
Yet there was a recent publication that may affect the IQ of kids who drank fluoridated water.
In the water.
Yeah, so I think there needs to be more research out there. Yet most dental offices, pediatric dentistry offices, use fluoride to treat when a child gets a cleaning, automatically gets fluoride application as well. So the scientific evidence is not as much as at this point as we have a correlation between gum disease and diabetes, for instance. Certain things are a lot more established
Wow.
in science than the fluoride itself, which is more current, of course.
I know. Well, sometimes you don't know what to believe when
Yeah.
you read it because it is somebody trying to push a narrative,
That may be the case. I haven't read the actual article.
I don't know.
But you need ample amount of data to really say something is happening.
Thank you.
And
Right there.
yes.
Do your homework.
Yes.
Not, just because it was on social media
Yeah.
or whatever, just do your homework because everyone just jumps to these conclusions
Exactly.
and then they're the expert. So do
Dr.
your
Google.
homework.
Yeah, Dr. Google is not
Dr.
good.
Google.
Yeah.
WebMD.
Yeah.
I know. Now let's get back to something you just said.
Yeah.
Correlation of diabetes and gum disease.
Is strongly established, yes.
Seriously.
And there are many papers and a lot of good data on that, basically. If someone is diabetic, will make the gum disease worse, but also the existence of gum disease in the mouth will make the diabetic status of a patient a lot worse, which I've treated many patients of that kind. Also, there is a correlation between heart disease and the bacteria that are in the mouth. Recent evidence on Alzheimer's and gum disease is being established. So there's a lot of research behind my specialty. Where I got trained at Boston University was one of the major NIH grant recipient schools actually in the
Right.
country. So there's a lot of information about our oral health, well-being, and oral health. So I would recommend all listeners and all patients thinking about it in that perspective as well. It's
Yeah.
our health and affects everything else, basically.
Well, that's why
Yeah.
when I was most people don't know this information.
Yes.
And, you put food in your mouth, you don't think the process of where does it go? How does it impact you internally?
Yes.
And obviously your gums, your teeth, and you could get sick. Like if you have a root canal, it gets infected.
Big
I mean, people
infections.
could die from infections.
They
It's
could, and I've,
it's crazy.
people sometimes don't address them on time, and then understandable because it doesn't hurt until it really hurts.
Right.
I give that example of that aspirin commercial of a guy who plays basketball the day before and has a heart attack the next day. We don't know until it happens. The same thing for an infection in the mouth. So many patients, we identify the problem for them. In my office, we have 3D technology. So we take a 3D imaging, like a CAT scan. So we see the problem, we inform patients, and they're all agreeable. Just everybody has a cruise or a wedding. Let's say we're in March, there's a wedding in October, and then Thanksgiving and Christmas. Well, can we do this in January? Well, we don't know what's going to happen in 10 months.
Yeah.
So we've had a couple of hospitalizations because people were not able to, one way or another, take care of the problems on time.
Yeah.
One extreme stayed about a month because they couldn't control the infection that was sourced in the mouth. And operations, of course, that become a lot more vigorous and involved.
Yeah,
when it
no,
happens.
it's no joke. Obviously, it's a big thing and people should pay more attention to it. That's why you're on the show. So one of the things I saw on your website, which, had some interesting information, was your sinuses.
Yes.
Now, explain that a little more. Obviously, with springtime coming, somebody who has those allergies, I mean, is it related?
Yes. So a lot of people have their molar teeth, even some premolars, in their sinuses. I personally have all my back teeth in my sinuses entirely. So if I have a cold or a flu, I may feel a toothache, but it doesn't mean you don't have a dental problem. So if it triggers such a problem, then it's good to get those teeth evaluated for cavities and for need for root canals sometimes, because while we think that we have a cold, we may have a dental problem there, because the same nerves take the sensation from there and related to the brain. And then, there are procedures we do to improve those areas for doing dental implants, replacing dental implants. Those are a lot more advanced procedures than average work we do, basically.
Yeah.
But in essence, it's important to keep in mind that the sinus is the upstairs neighbor, and anything happening up there or downstairs may relate to each other, basically.
So if somebody has extreme allergies and has had sinus surgery, they should probably go to someone like you to check.
Yes.
Okay.
So we would do a dental evaluation, and a lot of times, as I said early on, as we take 3D imaging, if there is a problem in the sinus, I can see it. Of course, there is another scan to be taken by an ENT specialist. So I've referred many patients to ENT because the problems were not dental, but more sinus related.
Right.
But it's good to get those checked properly in every aspect.
Yeah.
basically.
I mean, some people may not know that information.
True.
I didn't until I read your website.
Yeah, that's good.
I know. Now, for what you do, is this considered in some cases major surgery? Does insurance cover it? Or is it one of those dental insurance programs?
There are a wide variety of insurance programs, but insurances are businesses as well. So, and the coverage for more major work is not going to be there. So patients benefit out of reduced rates sometimes with dental insurances. I think that's the best thing, rather than them paying directly towards a dental procedure, because their maximum allowances are not too high for current fees among all dental specialties and general dentistry as well. So having a good insurance doesn't guarantee coverage.
I know.
And not only that, but also if one needs more work than an average, there is going to be out-of-pocket expense. And we're in an international area in Princeton, so we have patients from all over the world, and they're all well-educated. But I deal with those problems every day, so I can relate to old world people easily. I know which country has what kind of insurance.
Oh, okay.
Because some countries have their own, there's full coverage, but then the services they get for dentistry is very basic. The quality is low, because it's, in the end of the day, someone has to pay for it. And if the government is subsidizing the dental treatment, then what they provide as materials and instruments may not be up par to the United States.
That's true.
So
they always cut corners somewhere.
Yeah, so
it's insurance. What are you gonna do?
Yeah, the insurance. I wouldn't trust an insurance, but it's good to have it for some contribution. Yet, it's the best thing is to do is preventive work. Brush, floss, and see a dentist every
What about
6 months. Yes.
Okay, mouthwash. Do you recommend that?
Mouthwash, the over-the-counter ones have limited effect, yet they kill some bacteria. There are certain ones we use post-surgically, yet they're not good to be used long-term like antibiotics.
Okay.
So it's good to have a good breath every morning. It's a motivational thing, eating healthy, having a good, nice breath. Those are positive things. But the essential thing is mechanical cleaning, brushing, and flossing. Because by doing
5 to
that,
10 minutes.
yes, depends on the necessity.
Oh, I don't know. You got to put on some music for that.
Yes.
I'm just saying, like,
Well, end of the day, maybe ritual would be more easier than a morning brushing.
that's true.
But again, there are patients we treat with advanced disease, so they have a lot more surface to be clean.
Right.
And then also they're more vulnerable in disease recurrence. So when we treat someone, it doesn't guarantee they'll be fine forever, like any disease.
Right.
So if one undergoes a heart surgery and eats bacon 5 years straight, we'll need a second one because of
that's
clogged
true.
arteries, which I love bacon, but I eat it every couple of months. So everything, we have to do in moderation, of course, and home care has to be there. So we don't need those insurances that much. Then they cover everything you need: preventive work, x-rays, minor fillings, this and that. Basically.
Great. No, I really appreciate you
Of
coming
course.
in. This was, I hope somebody learned that you really need to floss and brush your teeth for longer than like probably less than a minute for most people.
Yeah, I mean, 3 minutes would be minimal for a super healthy
3 minutes
mouth.
is good. 5 minutes, you're going to have those little pearly whites going.
Yeah. But you don't need to see us that much. That's what
I know.
tell my
See, you got to
patients.
prevent
Yeah,
your
so
teeth
see
falling
me,
out.
less is better for you. I tell
Gum
my
disease.
patients.
And interesting. So again, do your research, people, and also go to local Dr. Uzel. You're in Princeton, right?
We're in Princeton, yes.
Okay. And all your contact information is in our feed. So again, just another way to support local. Thank you for coming onto the show. And thank you for watching the Jersey Buzz. And please like and share and comment on this post. Till next time.